Welcome once again. Dr. Pauline here, the pediatrician by profession and also the director of Chelena Medical Center. Having a good working and comprehensive experience in both public and private hospitals for 7 good years. So with a lot of passion and dedication, I need to let you know that we need to know how to take good care of our babies and eliminate them from getting diseases like malnutrition. And this is the question I bring to you, to your attention. Have you ever thought about the connection between malnutrition and poverty? In most cases, poverty or malnutrition is being associated with poverty. And when that happens, sometimes it is not people's wish to be in that situation, but because of circumstances. Why am I saying that? Some circumstances like unequal distribution and production of food, especially to the remote areas and some other urban centers, whereby people are really in need of such kind of food, at the end of the day, they end up not getting those services. And that's why they get themselves in such scenarios like malnutrition or maybe poverty. Why am I saying that also? It's because if the initiative of supporting them on agricultural activities and maybe some other activities that are money generating will be able even to eradicate that poverty. And when you have eradicated the poverty, malnutrition also is not going to be appropriate to us. So there are some factors which really contribute to this. And those factors, one being of limited access to nutritious food. As I have explained earlier, when there's a limited access, also there's also unlimited access even for the healthcare services, maybe supportive services. How do you think those people are able to stabilize themselves when the important and crucial services are being eliminated from them? At the end of the day, they will not achieve the same way the people who are getting the services. And that's where the difference comes. Another way we get that inadequate health care in most remote areas, rural areas, healthcare services you get are very scattered. And even if they are scattered, to make it worse, there are no drugs, there are no food supplements. Now, a person can go today to get correct services. Unfortunately, we get that there's no services. She gets back home. Another day the same. At the end of the day, the person gets tired, the human nature. And once he gets tired, he seems not to seek attention henceforth. As a result, our kid is suffering, even the entire family is suffering, especially if there's an outbreak of a disease like tuberculosis. Kindly let us get a concern on that and be able to eradicate it. Another way whereby people think there's a connection between malnutrition and poverty, whereby some of the people have poor living conditions. Poor living conditions, especially low socioeconomic factors, some are families. Maybe a family of 10 people getting congested in one house. In one house, maybe they are using firewood to cook, not enough ventilation in that house. Water supply or food supply it is insufficient. It happens if one of them gets a disease like tuberculosis, the entire family ends up getting it. What a crazy thing. So we need to look for ways on how to help such people, whereby the government, communities, other stakeholders, NGOs, and the other private sectors to come in and also assist such kind of people. Because it's not easy to come out of such a situation. It needs a hand to help. And by supporting each other, that's when we grow. So, other than poor living conditions, we get that even getting clean water is a problem. Sanitations, many of them, imagine, they don't even use the toilets. Some of them, they go to bushes and that's how they help themselves. But here's one question you need to ask yourself. What if it rains, especially when there are natural calamities and disasters, and they have their shower there, children walking barefooted, maybe they're in that stage of crawling, and that's how we get cholera, we get waterborne diseases. Kindly, let us try to eradicate such issues and make them comfortable also. We have also what we call limited education and awareness. How does that one come about in remote areas? Or some health centers are very scattered. In some ways, we get that healthcare workers are very understaffed. They cannot be able to multitask simply because of the workload, maybe simply because in some other homes they are very congested and impassable. Sometimes you get that the area is very insecure. So if you are not able to combat such issues, still malnutrition is going to be on a high rise. So another factor is whereby we need to make sure that nutrition intervention has been put into place, whereby food assistance practices are being put also into place, and some other food supply and maybe government setups, stakeholders, NGOs come and help such kind of people. Another way we need to create what we call investment in social services. How? How are we going to invest in social services to these communities, to these people, so that we are able to eliminate malnutrition? One, educating them, mentoring them, and also we need to follow up. And we need to engage them with community healthcare providers so that they keep on following up house to house and get to know is there any problem and how to tackle such kind of problem. Without working in collaborations, our efforts may end up being unfruitful. At the same time, we need to invest in such areas like proper sanitation and clean water storage for them to use. We need to empower the community and engage them in proper decision making and support them. At the same time, provision of services and resources, whereby equitability being put at the center of interest. Another way is about policy and advocacy. That is to address structural drivers of poverty, such as income, at the same time, food insecurity and lack of access to basic needs or services. So we should come up with good policies whereby you are able to provide food security, water security, and the basic needs or services of the people are being reached. Thank you for listening. Kindly subscribe. Comment. Good question. I need to pause you in your mind or to ask yourself, what do you think are the most effective strategies to combat or to eliminate malnutrition on a global scale? Malnutrition is a disease which has been taken years to eliminate it. And once people get more knowledge on how to go about it, the easier the better. And kumbuka, mambo yote lazima yafanywe na mapema. Since we say in Kiswahili word, mapema ndio best. Number one way or strategy, promoting breastfeeding. This should go more especially to first mothers. Need to be encouraged. Breastfeeding to the baby exclusively for 6 months is very crucial. So, those mothers need to be able to know that this is good positioning and attachment for the baby to get adequate breast milk. Let them remove the myths and the fact that when you breastfeed the baby, that's when the breasts are going to be big. So kindly get to know that you decided to get the baby, kindly care for the baby, and the breast is for the baby. Let the baby. So the breast milk is for the baby. Remember from our previous discussions. There's a time to breastfeed the baby. There's a time to relax also with Baba Watoto. So make the difference and set the priorities. And also, not that mtoto analia usiku, hautaki kunyonyesha ama unanyonyesha mtoto, maybe ashipi. Now you rush to give the baby porridge or milk for the baby to sleep, just to provide you and the husband a peaceful night. That's wrong. Give the baby a priority and also make sure that the baby is getting enough. Hii mambo ya kwanza kupikia watoto uji eti baba analalamika, mtoto halali, anasumbua usiku mzima. You decided to bring up the baby, you both of you. Make sure the baby, kama maziwa hayako ya kutosha, before you go and buy none, ensure that you have been taught about good positioning and attachment, and at the same time, the baby is getting adequate. None is number 2 option. You can revisit in my video which I had discussed, whereby you need to give the baby simply because you have tried all the way best. Maybe you have taken a lot of food that you are going to help your breast to produce more milk, but it has still failed. That's when you can go to none as an option. That's also number 1 strategy. Number 2, we are going to improve accessibility to nutritious food, especially when you go to healthcare workers. Make sure you get attached to a nutritionist. She's able to guide you well. What kind of food are you going to give the baby, and what quantity, and you need to know how you're going to do some also mixing of the food, because some problems pop up when the complementary feeding is being introduced. Some of the babies unapata wanakuwa allergic to some foods, maybe eggs, milk, whereby they get introduced earlier than the expected age. Remember, eggs or cow's milk should be started after 1 year. That's when the kidneys or the liver of the baby has matured to be able to do the proper digestion of those things. So supplementation of micronutrients needs also to be provided, like vitamin A. As I told you, vitamin A is good for the baby to boost immunity. Hapa kina mama nawahimiza mchukue watoto wenu hospitali. Ule wakati wake ukifika napima kilo and the height so that tupate kujua mtoto wetu ana grow vizuri ama kama agrow vizuri, what could be the reason? And that's why you are being given that book for the baby. We are able to chat all the way through. If we see there's a problem with the weight gaining or the height, we raise an alarm as early as possible. And from you get engaged with a nutritionist. And some other minerals or micronutrients you can get direct from the shamba or from the soko, whereby unaenda unanunua vitu zenye zinahitajikana kwa mtoto na unamtayarishia vizuri, yani vitu fresh. Fruits pia, let it be mandatory each and every meal una fruit kwa mtoto ndio iboost immunity kwa mtoto. Another strategies is whereby we need to enhance maternal and child health care. This is being started from the prenatal area, coming to nutritional counseling and immunizations. Wamama ni wengi sana wanakosa kuleta watoto wao kwa chanjo. Hizi chanjo huwa ni muhimu sana na njia moja ya kueliminate some of the diseases that can easily kill your baby. So ukiona kama makosa ama imetokea mtoto wako amekosa chanjo, kindly don't be ignorant enough to stay at home. Come to the health sector to be assisted. Manake magonjwa ya rotavirus, pneumonia, tuberculosis, rahisi sana kushika mtoto na sometimes huwa inamchukua tu. And that's why as much as they are readily available, the immunizations, both in private and public sectors, mama tupatieni kazi kwa clinics, tufanye kazi yetu na tuhakikishe mtoto wetu anakuwa kwa njia ambayo iko nzuri na unayopenda wewe na watu wako. Kitu kingine, promoting education and behavioral change. So once you get educated and getting more knowledge on how to undergo about some food preparations, proper hygiene, and the food handling, you are able even to eliminate some diseases like diarrhea and vomiting, na hii mambo ya minyoo. Because minyoo pia ndio njia moja ya kuleta malnutrition kwa watoto. Because unapata mtoto anakula mchanga ama sometimes anafika mahali tumbo imekuwa kubwa ama hasikii njaa kabisa yani. Kumbe hapo ndani yake ya tumbo linaenda kuwa kubwa. Sababu gani? Ni minyoo inaendea kuzana, ambayo hiyo minyoo inanyonya ile chakula yenye mtoto amekula. Baadaye isaidie mtoto, imagine unalisha minyoo. That's not okay. So let us observe hygiene and a proper food handling. At the same time, another strategy we need to address poverty and inequality. And so with that, we are going to ensure there's equal supply of food to both remote and urban areas. Whatever the case, either food, maybe water or sanitation or some activities which are money generating, we need to ensure that even in the remote areas, people also benefit. Another strategy here, we are going to strengthen healthcare systems. by preventive measures, curative measures, diagnostic measures, and also treatment of malnutrition. So this one goes to our healthcare providers, especially even the community healthcare providers, whereby they can eliminate the community on how to have these behaviors of seeking health as a priority, not to go into mitishamba. Because the mitishamba, at the end of the day, it brings a lot of problem. Another strategy is about investing in agriculture and the food system. This is whereby we need to support sustainability of agricultural practices, both small-scale farmers and even large-scale farmers. We need to provide local food production and diversify all those resources, whereby we make sure that there is also accessibility. Another strategy is about advocating for policy change. How are we going to undergo about it? Policy change, policies that prioritize nutrition are the one which are going to be given priority. We need to address food insecurity, whereby when there's food insecurity, what is supposed to be done? We provide security. We need to regulate food marketing practices. For example, the food marketing practices should be those ones which are encouraging our children to get good nutrition and to be able to grow well. We need also to support vulnerable populations, especially those in rural areas and impassable roads, or due to natural calamities in one way or another. They need to be given a priority. Another strategy is about global cooperation, global collaboration, and a partnership. This is where some global collaboration and partnership come into hand in hand to be of assistance. This ones can go to maybe NGOs, stakeholders, private sector to coordinate some efforts and share some resources, and also mobilize and support on a global scale. So when we do those things hand in hand with teamwork and also with equitable distribution, we are able to achieve our goal of eliminating malnutrition. So, however, we get to understand there's some contributing factors to those. One, we have understood in detail that malnutrition is not a simple thing, it's something which is complex. Complex in such a way, sometimes when mothers are being affected of HIV, the kid also can be affected. Lack of access of nutritious food. Some people, especially in remote areas and some other urban centers, we get that this access to the nutritious food is not available. Then there's what we call poor infant and young child feeding practices, especially when babies are being complemented other feeds. Haya, mama anaenda anachukua mbegu zapa, ndio hiyo mahindi, mtama, njugu, omena, anafanya kuchanganya kwa pamoja, kisha anaenda anafanya nini? Kusaga. Yani ile unga wenye uko na mbegu ngapi? 7. But at some extent, these mothers lack some knowledge and understanding that hizi mbegu 7, each and every one, each and every component has different boiling points and has different absorption criteria. Sometimes you get the baby is getting uji, mama ametengeneza anapatia mtoto. Imagine uji uko na kasafa, uko na wimbi, uko na maybe mtama. Kumbuka at the end of the day umempatia mtoto hiyo uji, lakini hakuna kitu inafanya kwa tumbo ya mtoto, yani kwa mwili ya mtoto. Kitu ya kwanza ni kuhakikishia below 1 year kidneys and the liver bado siko very immature, ni changa sana, asiwezi kufanya nini kuchucha hizo chakula vizuri, and that's why even excretion process inakuwa very slow. Mtoto anakuwa na constipation, na at the same time unapata mtoto saa yote maybe tumbo imejaa gesi, hauna raha yani na huyo mtoto. Now sometimes you get that as it progresses, because there's nothing is adding to the baby, and that is the daily meal for the baby, you get iron deficiency now comes in. Kiwango cha damu kwa mtoto kinakuwa chini saa yote. Imagine whereby you as a parent, just because of ignorance, maybe sometimes lack of knowledge and understanding, you get to cause your baby to have lack of enough blood in the body. To some extent now it's going to cost you, because the baby is going to be admitted, maybe done blood transfusion at your own expense. And that's why we say ignorance is very expensive, and ignorance hurts a lot. It's better to get to understand what you are supposed to do. Asking is good. Don't say that you understand everything. And that's why doctors are there, nutritionists are there. So when you want to introduce something to your baby, can you engage with your doctor available, so that you get to get more information on how to take good care of our babies. And at the same time, you get that there's inadequate healthcare services and sanitation, especially in remote areas. Imagine mama kungangana kuleta mtoto mpaka hospitali, kutafuta transport. Wengine ndio wanaamka saa asubuhi, haya mguu moja kwa moja mpaka hospitali. Kurudi kwa nyumba, kumbuka huyo mama hata hana hela ya kununua nini chakula. Those challenges are there. So we need to see on our way on how we are going to help each and every one of us to take good care of our babies, because this is our future. Now we have some solutions which we can offer to you, and some of the solutions can be permanent, and some of them can